Thank you for participating in the Wellness Wave. My name is Dasari, and I'm a medical student at the UCR School of Medicine. I'm currently representing ACP Region 2, and I'm really honored to interview Dr. Huy Au here today. Dr. Au, can you be so kind as to tell our ACP viewers a little bit about yourself and what you do?
Hi, my name is Huy Au. I'm one of the medicine hospitalists over at Riverside University Health System. I'm med-peds by training. I do mostly inpatient medicine. Pretty much since the whole COVID thing started, I've essentially become fully inpatient medicine just because there's not as much, that's where the need is at this stage.
Absolutely, absolutely. Thank you. We thank you for your service during these times. What advice do you have for rising medical students and current residents as they kind of navigate their path in medicine?
My advice in general is just going to be do what you enjoy doing. Like when you go into your rotations, give it the college try. Whether you think you'll like something or not, give it your best shot, and then see if you like it or not. And if you don't like it, then obviously when you're planning careers, don't pick it. But that way you'll know.
I was wondering, what are some key qualities that you see in students that come, that work with you, or residents that work with you, that, you want to pass on to some medical students and residents who are watching this?
For me, it's really, the most important thing is really attitude. Have a good attitude, work hard, care enough about, yourself, your patients, your colleagues, that kind of stuff, to put in the effort. Right. So anyone who's gotten this far, you have enough brain power to get the job done.
Right. I think it's all about like the kind of, like you said, the respect that you have for your colleagues, just that basic innate human, I see you as a human being, and I would like to have that conversation with you. That's very important, especially in primary care and as a teacher. More specific to our kind of like initiative in the Wellness Wave, we have a question more related towards mental health and wellness. In these current COVID times, something that I think it would be really helpful for our medical students and residents is maybe some advice on how to combat burnout.
Combating burnout is, that's a difficult thing. If you look at it as, and some of it, and I know it's easy to say it, but a lot of it, burnout is expectations. Like, the whole thing about happiness is expectation minus reality. Okay. Part of what people get, part of what I see people get stressed out about is that they expect one thing and see another. So temper your expectations, okay? Because like it or not, life is life. Just because you become a doctor doesn't mean all of a sudden you're going to be driving a BMW and living in $1 million house. Temper your expectations, okay? And do things you enjoy to not, to relieve the stress. It doesn't matter what it is. Sing, dance, I watch cartoons, It's whatever you enjoy, whatever kind of cools down your stress level.
Taking that time for yourself in a day and do something that isn't work is very important in these kinds of times. Just one more question on mental health and wellness, because I really liked your advice on how happiness is expectations minus reality. I think that put a lot into perspective for me just in this moment, is I guess how to stay strong, especially right now in situations where we're dealing with very difficult patient encounters. How to kind of stay strong when you're in those kind of situations?
It's difficult because it's going to be person dependent, but I do try to show empathy. And then same thing, and one thing is if they get frustrated, oftentimes, we have to separate out the disease from the person. Okay. So if someone is, or if someone or their family is angry at you, or if they're saying things that are making you angry, you have, kind of, and it's not appropriate, obviously, but it is what it is. I try to remind myself that, I'm seeing them at their worst, right? You don't expect the best from people when they're at their best. When generally, if they're in the hospital, admitted, sick, whatever, you're telling them they're going to die, they have cancer. You're seeing them at their worst. So you got to kind of a little bit of slack for that.
I feel like we learn a lot of this about empathy, but at the same time, how you said, it's not, the patient is not the disease. The patient and the disease are two different things. And I think that can actually help with that juggling. I think those are all the questions that I have for you in this mini short interview that we had. I thank you so much for sharing your knowledge with us. And I know our viewers, because I learned a lot, will definitely benefit from the advice. Thank you so much, Doctor.